Well, around the world, at least 2.6 million newborns die within a month after they were born, according to the World Health Organization. The majority of these deaths occur in developing countries where there is a lack of health care. A project called Nest 360 Degrees in the Rice 360 Degree Institute for Global Health in Houston is trying to reduce the number of preventable newborn deaths in sub-Saharan Africa. Viewers Elizabeth Lee has the details.
An internship at a hospital in Malawi was an eye-opening experience for Sonia Sosa.
Sometimes there are tons of babies and there are not that many nurses, so they're understaffed. It was really hard to work there, but then it also challenged me to really go back and work really hard to be able to provide this care that is accessible to them.
Sosa is one of several global health fellows who are developing technologies such as this one called Incubaby.
Yeah, basically, it's a warming crib
to help the most vulnerable patients in the hospitals of sub-Saharan Africa, such as Malawi.
Immensely tiny newborns with only the bare minimum of technology, if anything, available to them.
17 technologies have been identified, and together they can help prevent the top causes of newborn deaths, such as pneumonia and preterm birth in this part of the world.
Our students developed a solution that would cost on the order of hundreds of dollars, and not only address the fact that it needed to be robust and cost-effective, but also easy to maintain and repair should something happen.
Countries like Malawi have received donations of medical equipment in the past, but they were not always helpful.
I saw that all the devices coming as donations from first world countries, they didn't fit in there. People used it differently, put them in weird places, and when they broke, there was no spare parts.
These devices ended up collecting dust and becoming useless because they were not right for the environment.
That engineers, doctors, nurses aren't necessarily familiar and or trained with them unless they were gone to a Western school where they've been exposed to some of these technologies, but maybe even more complex forms. So there was a systemic change that needed to be addressed.
Part of that change includes developing technologies that monitor the temperature and the respiratory rate of a newborn while also being low cost and sustainable over time.
For the harsh environments, it includes inconsistent electricity and also very dusty environment, lack of maintenance, and spare parts.
We're in some cases incorporating battery power where it's appropriate, and then in other cases testing out backup power, or including sort of with the Nest bundle of technologies, a package of solar power, so that when there are those blackouts, there's a backup system.
Of the 17 technologies, some are commercially available. Others are either in clinical trials or in early prototypes. The goal is to eventually develop all the technologies, scale them, and roll them out, first in Malawi and eventually to other countries that need them. Elizabeth Lee, VOA News, Houston.